Okay, sir. Okay, sir. Good evening to all IFPH members, doctors, and colleagues, and my good friends. It's time to English session. Today is our 2006 day of uninterrupted daily webinar of IFPH, International Forum for Promoting Homeopathy, on 27th Feb 2026 at 8:30 p.m. Before proceeding, 1 minute silent prayer. Now, our today's guest is Dr. Prakash Rao, sir, BA PG Rehab, MD, PhD Homeopathy, retired research officer, CCRH, Government of India. Sir has more than 30 years of experience at CCRH, and he undertook projects with UNICEF and AIDS Controlling Society. His topic is Infertility, Homeopathy and Research, Part 6, PCOD. And sir, you can start your presentation.
Good evening to everyone. Good evening, Dr. Dhanesh sir. Thank you very much. Today you are present. Our meeting is this topic today is infertility, and hope I will finish this. I thought that I will finish with this, but I could. Today topic is sufficient enough only to control primary infertility in women and male reproducibility, male increase of seminal count that needs a separate topic. Let us think first with this the conventional management and limitations of primary infertility in women. Why patient comes to homeopathic treatment in infertility? What happens with either infertility or with any case? The homeopathic doctor get the case only after failure from the conventional medicine, but intentionally as priority choice, nobody comes for homeopathy. So why they come from to homeopathic treatment from the conventional system of medicine? What reason is conventional limitations, the modern system's limitations. Modern medical management includes ovulation induction, hormonal replacement, intrauterine insemination or IUI or what if you see that IFC, in vitro fertilization, IVF. So in selected cases, the approaches are associated with number one, high cost, number two, hormonal side effects, number three, emotional stress, limited impact on underlying systematic imbalance, need to be completely complementary approaches, particularly homeopathy. So when the high cost, when the side effects, all the 90 cases, science is having one limitation, that is science won't be perfect in all 100 types of cases in 100% of success. So naturally, some of the cases never listen to science. Science will not cover. So such cases will come to homeopathic doctor. Then conventional medicine focuses on hormonal management assisted with reproductive technologies and surgical corrections. So this nobody likes because the one is number one is cost effectiveness. Number two is handing over body to a doctor, particularly with anesthesia. And some most of them, what happens, they will undergo with some of the body and changes that because of wounds. And homeopathy offers a holistic, individualized approach aimed at restoring physiological balance, and reproductive harmony. So, naturally, when the conventional medicine focuses on hormonal management, naturally there will be changes, and the hormonal management results in multi side effects, particularly diabetic, lifestyle disorders, obesity, and one child. Then naturally there will be various complications. So ultimately, patient chooses the alternate system of medicines, particularly homeopathy. So, and the other type of cases that usually the we receive in our cases is after failure and high cost. After sitting with two, three sittings are over and high cost management, but for each sitting there needs to be around 2 lakhs rupees. So once the patient, if they are not successful with IVF within 2 or 3 sittings, patient comes to homeopathic treatment. Once a rejected case or a failure case in conventional allopathic system of medicine has to be rectified with homeopathic treatment, and we have to show a successful results. So this gives a lot of stress and tension to homeopathic doctor. And but despite of all these things, the homeopathic doctors are highly successful with their treatment, particularly in primary infertility. Last time I have shown in my 5 episodes that the results that have been taken up to primary infertility are as equal as allopathic IVF, IVF as well as homeopathic treatment. If they find out the correct diagnosis and where is the defect, and if they individualize, if they correctly give the individualized treatment, definitely they are going to get same type of results. And the result ratio in between homeopathy and allopathy, there is no difference, and that is the specialty of homeopathic system of medicine. Despite various new, when we compare with modern research methodology, some of the concepts are outdated, but despite of all the lacunas, the success rate of infertility is equal with the allopathic success in infertility, either with IVF or with hormonal treatment. So that makes everybody, that makes particularly a researcher like me to see that wow, how this is happening. So the primary infertility in the woman, why I already spoke over the 5 topics. I am not reproducing those slides. Here I want to give the statistics as well as the successful notices of the medicine that has been given excellent results. So the primary infertility in women is an infertility in women of multifactorial reproductive disorder characterized by inability to conceive after 1 year of regular unprotected intercourse in women who have never achieved pregnancy. That is after the marriage and with free sexual romantic opportunities, if a woman won't conceive, multifactorial reproductive disorder, and that we have to diagnose. The primary infertility refers to women who have never conceived despite adequate exposure to concept conception opportunities. So this is taken time, and this condition is not merely a localized reproductive pathology, but often reflects systemic, endocrine, metabolic, immunological, and psychosomatic imbalance. This is systemic disorder, endocrine disorders, metabolic disorders, and endocrine disorders. Both are same. The metabolic disorders may be one of the cause is obesity, and immunological, that means when the ovum has been secreted, it will not have power to have immunomodulation to conceive and receive spermatozoa, and psychosomatic imbalances, particularly the psychosomatic imbalances are in some of the families, though that despite the ovum and expulsion rate and regulatory things are present, the fertility won't take place because of the stress conditions, and it avoids the spermatozoa and it comes out. So these are the conditions which are being addressed very well with homeopathic treatment. Number one, the primary, why I am taking primary infertility means infertility, as I told previously, that it is because of various reasons. I don't want to reproduce those slides. That's why I'm again and again. So when we have taken primary infertility for women, and here we have to take again infertility of men. Think that in primary infertility, we have got a women patient who has been never conceived despite adequate exposure to conception opportunities. So that is for a woman a single disease, systemic and endocrine, metabolic, immunological, and psychosomatic imbalances are present. Such a primary infertility case, how we are going to get success? and how to treat it, what are the probable causes. Let us discuss further. Only primary infertility again and again. The primarily infertility and homeopathic concept. This everybody thinks that just talking about homeopathy and homeopathic concept is very easy and everything has been attached in. But in research, it won't be like that. Samuel Hahnemann conceptualizes infertility. This is only a concept. But if we take concept, if we go behind this concept in research methodology, it will be a tough one. And how he developed concepts, why we have to do research, how this concept has been found out, and how he derived to this conclusion. It is really whenever we do research, whenever we find that concept is totally exactly correct, it gives surprises and it gives see why this man is so intelligent. Had he been today, he could have made the homeopathy in the place of allopathic system of medicine. So his conceptualizes infertility as a dynamic disturbance of the vital force. All are vague words. Dynamic disturbance in vital force. What is that vital force? Whether it is vital energy, whether it is the life, whether it is the body. No, there is a conceptual derivation is as a dynamic disturbance. That means there is totally a disturbance in the physiology of the body and influenced by inherited predispositions. That means inherited by predisposed, um, influenced by inherited predispositions. That is genetically endorsed, genetically DNA changes. Today's language, acquired diseases, that is epigenetic disorders. That means a person is think like this, epigenetics is as a child, the person or the particular female girl is having common cold and that common cold girl has been given epigenetics, prednisolone or other steroids and she will be developing excess appetite and she will be going on eating, putting weight, and ultimately leading to obesity, that is acquired diseases. So, which acquired diseases he never mentioned, but he knows that some of the acquired diseases and lifestyle factors, these acquired diseases will are known as epigenetic conditions. In epigenetic conditions, what happens? Patient takes some treatment for some other disease and he will be going on, she will be going on putting weight, number one. And lifestyle factors, the lifestyle modifications, the lifestyle factors are so much doing too much of hard work, labor work in the sense working as a child labor and being exposed to noxious agent. That means if a child has been exposed for anemia, for too much of laborious social body work, and there will be the ovaries and the uterus will not function in a normal way, and there will be nutrition deficiencies. These all come under lifestyle factors, acquired diseases, epigenetics, and emotional stressors. Emotional stressors means excess poverty and too much of money, that all will leads to again obesity complications. So these are the emotional stressors. Rather than suppressing the symptoms, homeopathy aims to stimulate self-regulatory mechanism to restore fertility. Homeopathy, see, there is one speciality. What homeopathic system never goes again is the nature. Suppose if you ask a homeopathic doctor to give anti-conception pills, not to conceive, it will be a difficult task for homeopathic doctor how to give family planning pills for a woman who is having regular menstruation. No, homeopathy can't do that. So we have to withdraw from such ideas. Many times, the in research, what happens? The secretaries of health who are with IAS qualification, they will cut a joke. Will you give preventive medicine? Every doctor says that we will give preventive medicine for various disease conditions. Then why don't you invite a preventive medicine for controlling of the birth? So homeopathy never goes again in the nature side. It cures the natural disorders in a natural way. and it never goes again is the nature. And see, having menstrual cycle regularly is a natural process. Then they said that your theory is something done and criticized and suppressed. This happens many times, this happens every time. So the mechanism to restore fertility, to stimulate self-regulatory, homeopathy aims to stimulate self-regulatory mechanisms and going through the nature, going with the nature is the first aim of the homeopathic treatment, and homeopathy succeeds in that. Let us go through that. Holistic understanding of homeopathic infertility. See, homeopathic concept of primary infertility is holistic understanding, mind, body, and speech. What happens in mind, what happens in physical body, and what happens the spirit, that is the soul. First mind, one is see mentally if the patient is normal or not. What is the emotional stress that she is undergoing because she don't have children, and what is the defect in my body that because she don't have children, what is the defect? Whether ovulation is not present, where the ovary is not present, or the follicular stimulation is not present, or progesterone is not up to the mark, or progesterone being secreted excessively, or the estrogen is produced less. All these things we have to understand that comes under body, that is known as diagnosis. Mere diagnosis is not sufficient to treat the disease. We have to take the reactions of the diagnosis over the mind. That means at that time the present mental symptoms, that are the way the mind is undergoing, what type of stress that a mind is undergoing, that comes under mind. Second is body. Third is the spirit. In the sense, what is the spirit? In the sense, what is the soul? Why particularly infertility is present only in these women? So whether it is a genetic cause, whether it is a familial reason, whether it is the really ovary is present, whether the uterus is a small infantile uterus by birth, whether uterus is present or only the canal, vaginal canal is present, these all comes under soul. We have to investigate, we have to examine, so we have to go for holistic understanding, and we have to give mind, body, and soul theory treatment. Then only the homeopathy will be successful. For that, a personalized medicine in the latest world, which we know that is the totality of the symptom, individualized medicine, and constitutional medicine are prescribed, definitely will give good results, yield to good results, except there are physical defects. Number two, homeopathy views infertility as a functional derangement rather than irreversible structural damage. See, irreversible structural damage means by birth there is no structure, anatomical structure that is present. So that becomes definitely irreversible. But when the infertility is a functional derangement, the ovary is present, the uterus is present, the ovarian canal is present, the follicular stimulating hormone is present. Despite of this, the male spermatozoa is also present. Despite of this, the female is not conceiving from last 12 months after the marriage. That investigations, that understanding must be there, whether you call investigations, whether the understand the disease, and that is known as functional derangement. The one word functional derangement gives the total diagnostic aspect of the primary infertility in a woman. Number three, the manifestation of miasmatic influence. Again, miasmatic influence is a concept of miasms. The concept of miasms may be right, may be wrong, but most of the treatment, individualistic treatment, we will apply the concept of the miasm to the person, to the present existing disease condition, whether it is right or wrong, whether the miasm has been applied or not. In research particularly, we never do apply miasmatic concept. Despite of that, we will carry out the clinical research. It is giving a success rate. And particularly in vitro studies, the question of miasm never arises. So we will never apply for anything except testing the drug. But when we take the case, when we approach the patient, when the miasmatic influence, whether it is psychosis, whether it is syphilis or SORA, though the the judgment, the teaching lines are not up to the mark with the pathological investigation. Whatever a physician he understood in life, that what are the mathematic approach, and if he applies to the manifestation of the disease, definitely he is going to be successful. And all the success theories are coming by applying the miasmatic theory. And miasmatic theory is one of the prescription way of art in constitutional prescription. So it is part and parcel of constitutional prescription. Whenever the success comes, the miasmatic influence, the miasmatic concept is becoming going to become right or wrong, but the ultimate success result contains the miasmatic influence. So miasmatic influence is a manifestation of physical body. The physical body is again the a functional derangement. So the miasmatic influence, functional derangement, all are same. So the concept of applying miasmatic influence is also one of the part of understanding the case in case record as well as showing the cure. So of a constitutional prescription success. In the sense, when we are successful, we say that the constitutional prescription has made us successful. When we failed also, we have to always study why the constitutional prescription has failed. Usually everybody refers why he failed, but always whenever we are successful with our constitutional prescription, we have to always study the total functional derangement and the case record. If we understand how we are successful in particular case, the second case we will see that it will not be it will not fall under unsuccessful case treatment. Naturally, we will understand what are the concepts that through homeopathy we have to apply, and we will be definitely successful. And the concept of primary infertility, according to homeopathy, again is a disturbance of hypothalamic pituitary ovary (HPO) axis. Hypothalamic pituitary ovary axis. So again, as a functional derangement, part-time functions, the functions that controls the mind, body, and in body again is he came again to the physical structure of the body, that is hypothalamic pituitary ovarian axis. Again, he considered himself, the Hahnemann has given a picture that hypothalamic control in the brain and pituitary gland function, hypopituitary, hyperpituitary. Both will affect have a greater influence on primary infertility, and hypothalamic effect, that is the neurological effect, and pituitary effect, that is the pituitary gland effect, which will control the hormones. And third is ovarian axis, where the ovary, whether it is size is normal or abnormal, whether it is big or whether it is dying before reaching the Gaussian particles, or whether it is dying before reaching the fallopian tubes, or whether it is dying and reaching the axis and the body of the uterus. What is happening to the ovary condition? This was also part of the disturbance of the HPO axis, which comes under holistic understanding of the disease according to homeopathic concept. So homeopathy has not overruled the diagnosis, but mere diagnosis is not sufficient. Functional treatment for functional derangement, miasmatic approach, one of the manifestations of understanding the body structure, and a physical body structure is hypothalamic pituitary ovarian axis. This is the concept of the primary infertility in detail by through homeopathy. Then what is the therapeutic object of the homeopathy for primary infertility? Number one, the therapeutic object is restoration of hormonal rhythm. See, in those days when Hahnemann has invented organon of medicine, what he has written therapeutics, we do not know that what are the hormones, what are the endocrines, what is that rhythm. But restoration of hormonal, he knows that the hormones are present. Hormones are something responsible. And when we treat, when we apply our medicine like Palestilla, Natrimur, Sepia, or some other medicine, it definitely will have action over the things and it will rectify. This is known as the concept of understanding the case, the concept of the miasms. Some of the concepts are not up the mark, but the concept that there are hormones present where the endocrinal system is not totally developed. At that time, the Hahnemann has thought of hormones, a word that is the restoration of the hormones. What is that restoration? At that time, he was not having scientific infrastructure, but he expressed his desire and he expressed his concern for hormonal excess and hormonal restoration or hormonal disturbance in his organ and improvement of endometrial receptivity. What happens to the endometrium? He knows the value of the anatomy and he knows that there will be an endometrium. That endometrium will have receptivity, that is the improvement or a tendency to accept. I discussed in my previous things where the endocrine fluid is, if the pH value is less or if the pH value is more, the infertility takes place. But this was also has been observed that receptive endometrial improvement, but he don't know more than that because in those conditions that developed science was only up to this one. Correction of psychosomatic stress. He knows that there is stress, but he never used the word stress. The word stress is added again by the latest modern scientists. But he knows what is psychosomatic disorders and what are psychic disorders, what are psychosomatic conditions. The correction of psychosomatic condition is again the correction of miasmatic influence, SORA, syphilis, psychosis. If there is a double complex disease or a triple complex disease or multi-miasmatic disease or single miasmatic disease, this was understood. That's why he corrected and he used the word psychosomatic correction. That means multi-miasmatic, stressful condition, psychosomatic aspects, and psychosomatic body, the correction of psychosomatic tendency in the body, and he don't know more than that. But now it is known as psychosomatic stress because of lifestyle derangements and epigenetics. This was also the word epigenetic was not given, but he told acquired diseases. The acquired diseases are from nature, and that acquired diseases have been discussed by Hahnemann. Fourth thing is enhancement of overall vitality. Vitality means again not the vital force. Vitality means the strength of the body. The body should not be less nourished or more nourished. Body should have normal vitality. That is the normal functions and duties of the every organ has to be properly in a working position. So overall vitality and the enhancement of the vitality, the enhancement of the strength. What is the word enhancement of vitality means? Again, the appropriate age of the fertility and appropriate age of the fertility rate in women. These all conditions have to be kept in mind. Then only the therapeutic objective of removing the primary infertility will come into force. So Hahnemann in his aphorisms, see how he thought of therapeutic objectives, how he thought of every disease condition in his 70th aphorism, where it is a double complex disease or single type of disease, how to be addressed without the infrastructure of the scientific knowledge present today has been discussed by him in his aphorism and the disease classifications of aphorism number 70. Then, what is the mechanism of action of homeopathic medicine in primary infertility? Then we discussed about the old, everybody says the dilutions are not up to the mark. Everybody says how the potentization is present. Everybody is asked where is the repeatability or reproducibility in homeopathy. But despite of all these things, when the organon is fully understood, if we remove some of the topics, the every topic and every concept is a gem that particularly understanding the patient and understanding the disease classification. The disease classification is so nice Even today, the modern scientists can't beat and the disease which is curable, which is not curable. If it is curable, under what circumstances it will be curable. If it is not curable, under which circumstances it is not curable. The disease classification has given the unlimited knowledge of the personal medicine or the specialized medicine or genetic medicine or crisp medicine for nowadays doctors. That is the mechanism of action of medicines in primary infertility. Homeopathy, although medicines are ultra diluted, I told about you, the energetic scientific interpretation process, regulatory and informational mechanisms. See, this was carried out like informational mechanisms. Regulatory, what is regulatory? That means the normal physiology of the body. What is informational mechanism? The normal physiology has been became abnormal and became disease. And what is this informational mechanisms? We thought that the homeopathic medicine action is a regulatory informational mechanism. We based some concept and we prepared that homeopathy acts like this. Once we are successful after treating the case, we felt that it might have acted like this, it might have acting like this, it might act like this, it may act like this, but it is all not confirmed. The first evidence is the homeopathic dilutions, the RDR dilutions. The word ultra dilution was not used by Hahnemann. It is only diluted. The diluted and succussed and the potency will increase. But there is now more controversial about the potentization and everything. So we have taken up our research only with the power of 6C because we don't want to enter into unnecessarily being dragged into controversies. So we want to see a double-blind randomized methodology and in vitro studies with 6C potency because X is nothing but 100 quantity because we are seeing the power of the medicines according to Avogadro up to 11th potency and 12th potency and 6th potency. There are the molecules of the drugs are present. And again, I am telling when the molecules are present, there will be nanomolecules also present. But the nanomolecules conversion being molecules being converted into clinical therapeutics has not been noticed, but whereas the molecules and the ions and the dynamization of the potency has purified the medicine from toxic effects. And when the purification took place in potentization, the efficacy also comes down. That the multi-dimensional efficacy will not be present, but at the same time, the physiological efficacy definitely will be present. So we have to explore the medicine that with physiological dimensions. So we have to give the low potency. This is only our concept, but there are various cases which have given highly successful rate with ultra high dilutions. So we never use the word ultra high dilutions because they are all concepts and we never use the regulatory informatory mechanism until and unless we see in our research that what is the real mechanism. So these two things are nowadays coming in homeopathic scientific theories, ultra high dilutions. It is not that we don't believe, though we believe research wise we are not finding out anything, and research wise we are also being dragged into controversies. So to avoid the controversies, we started proving, we started giving the medicines in 6C potency. And that why not 6C with 12C, 6C with 10C, 6C with 3C? The first is number one, we don't want to enter into unnecessary controversies. Number two is we cannot prepare those medicines. Number three is when we prepare the medicines, they may not be up to the standardized potency. But when we prepare the already prepared biological and pharmaceutical companies' medicines, particularly Byron Company, it is not that the Byron Company is good or bad, but we are taking legally transparent certification and we are testing the 6C potency. So we are finding excellent results. It doesn't mean that who have got results with ultra high dilutions or CM by 0 potency or 1 by 0 potency, 1 by 0 by 1 potency, 0 by 2 potency, 0 by they are wrong. But it is not like that. We have to show the reproducibility. So we are answerable as a researcher in government research organizations. So we have taken up the routine 6C potency. This is first is neuroendocrine modulation. See, Hahnemann understood that is stress. What is that stress? He used hypothalamic pituitary ovarin, measurement influence, functional derangements, holistic understanding, and aim stimulation, restore fertility. So these theories will definitely come under neuroendocrine modulation. Stress is that is just nothing but neuroendocrine modulation. See, I am under stress. The adrenal glands are functioning too high. So when there will be antibody against the adrenal glands functioning when we drive the vehicle, naturally we will be under stress. So we have to control the stress. We have to cool down. Then only we can drive the vehicle. That is known as neuroendocrine modulation. If the neuroendocrine modulation is not up to the mark, there will be error in judgment. The error in judgment leads to lack of confidence and accidents. In the same fashion, the neuroendocrine modulation will always leave error in judgment when the normal physiological body fluids or body reagents, body hormones will take place. There will be abnormal levels in the body. That is, the biological response to modified homeopathic medicine acts as a biological response and modifies the normal neuroendocrine modulation. When the normal endocrine neuromodulation disturbs, when there is the disturbance itself is known as neuroendocrine modulation, that is psychological stress, psychological worries. The homeopathic concept is holistic. Number one is mind, number one is spirit, number two is mind, number three is body. So the first part of the spirit is neuroendocrine modulation. The neuroendocrine modulation comes from mind, where the biological response will be modified, where the body will take a decision when we are under stressful condition. Again, I told that stimulation of adrenal gland. Why the stimulation of adrenal gland happens in particular persons? Why not in everybody? That is again comes to the individual theory. That is that particular person who is having that thalamus, and that type of thalamus will produce neuroendocrinal disorder. And when the neuroendocrinal disorder happens in that particular person, that is known as familial genetic family history, then that genetic family history will be converted into endocrinal family history, and the endocrinal family history will have endocrinal organ history, and that endocrinal organ history will give again to the symptoms. This is known as neuroendocrine modulation. That is in one word, stress. That stress is also having genetic causes, stress is having familial causes, stress is having genetic DNA modulation. Again, DNA genetic modulation will have effect over the organ, and organ will be modulated. The abnormal results will come, and homeopathy regulates this neuroendocrine modulation. This is one way of the theory when we find in farm eyes when they were not having this neuroendocrine anxiety, restlessness, fear, going out of that, retching here and there despite of the food, increasing palpitations, increasing the mild diastolic blood pressure. These all have been noticed. So this is neuroendocrine modulation. Then that will be first rectified. Then influencing HPO. HPO, I told the thalamus, hypothalamus, pituitary, ovarian axis. So improvement in HPO will come, and human neuroendocrine and improvement in influencing HPO, human phenotype pathology. This is known as HPO thalamus. That is human hypothalamus, pituitary, and ovarian axis. This is phenotype ontology axis. So it will be regulated by homeopathic medicine. Biological response modification. If the biological response modification is DNA has to be modified, it will be modified. If the person has to be kept under control because of hypothalamus, that also will be done. And by that, it influence HPO, that is human phenotype ontology, that is ovary, pituitary, and hypothalamus will be regulated by homeopathic medicine and normalize GnRH pulsability. The GnRH is general RH pulsability, where it transforms into ovary and where the normal endocrine results will come, and regulates follicle stimulating hormone luteinizing secretion. See, one homeopathic dose, either in vitro or in vivo fertilization, when the blood samples have been taken after 1 week after giving the medicine, so much of pathology, physiology has been found. This is regulating FSH and LH secretion, supporting corpus luteum function. See, where is the homeopathic drug like silicifuga, and when it has been induced as a 6C potency, and when it has been induced through injection, when a normal parrots have shown supporting corpus luteum function and restored the ovulation cycle and functions of infertility. This is the change that has been noticed in parrots. Then, mechanism of action of homeopathic medicine in primary infertility. Number 2 is epigenetic and gene expression. Epigenetic is environmental expression, and that environment will change the gene. That's why many people who have epigenetically have been changed. Suppose, for example, I will give you Valmiki has written Ramayana. Epigenetically, he has been modified, but actually his profession is entirely different. So epigenetic will have greater influence on the gene rather than the gene itself. The gene itself will keep the shape, and epigenetics will have enormous effect over the genes, and that epigenetic changes expression regulation has come with homeopathic medicine. Number 2, the research in system biology suggests that homeopathic remedies influences gene expression patterns, signal of transduction pathways, the pathways that bodily, what happens when neuromuscular degeneration or neuromuscular transmissions are taking place, the particular body, the particular mechanism of the action of the remedy, the particular whether ion or the particular toxicity of the medicine will affect it, the neuromuscular things. When the neuro dimensions, when the neurotransmissions are taking place, the organ will become automatically all right, and organ will do its function hormonally, and gene expression patterns will change. Signal of transduction pathways will be regulated. Cellular stress response mechanism will come down, and such a regulation improves ovarian response and endometrial response receptively without exogenous hormones, without in the sense we have given medicines, we have not given hormones to support the ovary. Only the medicine that has worked in vitro, and one injection has made changes in the levels of the hormones of receptive organs, that are parasites, without changing anything in the hormones. The hormones levels have been increased. So, mechanism of homeopathic medicines in primary infertility. Number 1 is neuroendocrine modulation. Number 2 is epigenetic gene expression regulation. Number 3, immunomodulatory effects. See, one homeopathic medicine, see what are the pathways of the medicine's action. We do not know in homeopathy. But when we have taken up research, we have taken up research only to see how homeopathic medicine will be successful in treating infertility. How infertility has been produced when the artificially injected rats have been injected to have infertility, where their ovulation function has been discarded and they were treated with artificial anti-inflammatory condition and metabolites injections. So that they have been once homeopathic medicine has been introduced, the immunomodulatory effect started coming. In cases infertility associated with autoimmune or inflammatory stress. See, number one, we have to test one by one parrot with one by one antidote injection that has been given to conceive and give one medicine and see different medicine actions in different parrots. In the same case, in cases of infertility associated with autoimmune inflammatory states, when the inflammation comes, what happens? There will be pro-inflammatory cytokines and anti-inflammatory cytokines. When we have given pro-inflammatory cytokines to the rat, in cases of infertility associated with autoimmune inflammatory states, the pro-cytokines, inflammatory cytokines have been totally reduced. And homeopathic medicine reduced low-grade inflammation. It what has given the low-grade inflammation of the uterus, inflammation of the salpingitis, uveitis, ovary inflammation. Low grade in the sense if we give more inflammatory injection, if we give the pro-inflammatory cytokines more, the rats may die. So we have to see whether the homeopathic medicine is having any anti-inflammatory cytokinic effect or not. So the low inflammatory cytokines, that is low grade inflammation, has been reduced and improve immune tolerance in some of the ovaries where the immune tolerance has come. In the sense, after giving the homeopathic medicine and after giving the pro-inflammatory cytokines, the particular organ, either uveitis, salpingitis, or ovary uveitis condition, or endometriosis, not metriosis, endometrial infection, and cervicitis, cervical infection has started showing response, and every part of the uterus has not being affected with the inflammatory conditions, and some of the parts of the uterus have started developing immunity and not responding to the pro-inflammatory cytokinic and support to implantation physiology. In the sense, the endometrium and the uterus, cervical fluids, and the the cervical pH has started increasing and came to normalcy with the treatment after being induced with pro-cytokine injections, pro-inflammatory cytokine injections. Gradually, after giving the sinisifuga is the medicine, and it started supporting implantation physiology. That means the pH value of the vaginal fluids have increased to normalcy, and these are some of the reactive changes. Then mechanism of action of homeopathic medicine in primary efficacy, psychoneuroimmunomodulation action. What is psychoneuroimmunomodulation action? I will tell you the recently happened COVID-19. Everybody never got the COVID-19 results, or everybody never got COVID-19 disease. Some of they died because the death rate is 2% out of 100. So whatever may be the quality control of the treatment, whatever may be the care, 2% have died. So 2 into 10 means again it will become around 20 patients. And for 140 lakhs population, some of the families have disappeared because of the 2% of the death rate. At some of the place, some of the families are totally secured. Some of the who survived, they survived. They are the luckiest persons. So this why it happens. It is psychoneuroimmunological mechanism where the psychology will be produce give instructions to the neurology, and that neurology will give immunology that you kindly produce antibodies, and that production will convert into physiology, and this psychoneuroimmunological condition is coming with the scientists have been found very late. But how the Hahnemann fellow he developed this concept in vital force, and it's really surprising what he studied, what he did, we do not know. But this is really great. He discussed when Vibrio cholera came, and he told that it is coming through drinking water. The drinking water is having noxious agent, and that noxious agent is later found to be the Vibrio cholera bacteria. And that is really the organism, that is what he is a gifted mind. So the psychoneuroimmunity theory also, the latest psychologists or latest immunologists developed later, but this is a copy concept from homeopathy, and this theory has been developed only by Hahnemann. He quoted that all the patients who got tuberculosis, who got plague, never got all the nursing staff never got, physicians never got. Some of the physicians have been affected because they are being exposed. So why they never got? He has explained very well in his theory of vital force. That action has also has been the emotional stress directly impacts fertility through cortisol and prolactin pathways. See, this has been controlled. This is wonderful observation of the Hahnemann. But though we know there is nobody to explore this, and there is nobody to point out, and there is nobody to publicize that we are the first persons 200 years back. The theory is ours, and we have induced this, and we though we have are showing scientifically, this is ending only with me, with my research, but there is nobody knows that you are copying again, and we have to take patent properties of our organ of medicine. And individualized homeopathic prescription reduces anxiety, emotion suppression. Why I used here individualized homeopathic medicine means this each research we are conducting, we are finding out this psychoneuroimmunological mechanism of action. So here I use the individual medicine instead of our own research medicine, because in each individual medical practice, the psychoneuroimmunological mechanism plays an important role and restore mind from body coherence. See, this mind body theory, mind gets a confidence. See, most of the people who comes to our OPDs, they tell that, sir, you give your medicine. Why are you not giving your medicine? I will take my conventional medicine. I am under cardiologist treatment. But you kindly give me this medicine. I am feeling better. What? Is it placebo effect? No. Placebo never controls him. Is it a no? It is the emotion psychoneuroimmunity. That is the second one. The individualized homeopathic prescription reduces anxiety. How the anxiety will be produced, particularly in hypertension patients, the palpitations will be going on coming, the arrhythmias will be going on coming according to age. Though a stunt has been passed in a hypertensive or diabetic patient where the arteries are clogged, but whenever he will be under stress, there will be palpitation, so he will be afraid, and they will give the control and sleep medicines. But patient wants that, he knows that he is going to get palpitations, he knows that he is worrying, he knows that his worry has to be controlled, but it will not be under control. But he founds whenever we give, particularly medicine like aconite, the fear. Though he says fear, it reduces anxiety. The medicine like argentum, nitricum, gelsemium, definitely it controls. So the educated, even the doctors will ask, you kindly give a medicine for anxiety. We give medicine for fear, that is aconite, and that controls only anxiety. That is known as the reduces anxiety axis and restores mind body coherence. This is most important. This definitely happens. This has been proved on parrots. This has been proved in clinical studies. This has been proved in results. But despite that, because of the potentization, because of the lack of reproducibility, because when they take the rubrics and they miss, and that we have to develop. In research, we are also developing a medicine with particular potency, with some of the factors that have been taken, pathological investigation, physiological symptom, mind symptoms, and get together. We are working on SOP, standard operative procedures, to see that reproducibility comes with the medicine. I hope if everything goes on very well, within 3 months of time, the SOP for every disease condition will come up, and each disease condition, whether it is being treated at Hyderabad or at Pondicherry or at Kottayam or at Kochi or at New Delhi, if you follow those some of the principles of homeopathy, and reproducibility is going to come, restoring the mind body coherence. So improving the fertility outcomes in stress related infertility. The infertility itself for a woman will produce a stress condition. We have to understand that. So there need not be any other stress condition in Indian society. Not only in Indian society, even in foreign societies like China, Indonesia, Bangladesh, Pakistan, even in foreign cultures, they are having family system. Everywhere the behavior of the women will be same because of the hormones. Everywhere they will have a passion to develop see long hairs, good hairs, style, color. They always think that is only because of the hormones that they are presenting, particularly luteinizing and thyroid stimulating hormones. And so the homeopathy in vitro studies have also found that primary infertility will come and stress related infertility. Stress has been produced on parrots by giving adrenaline, and the adrenaline will flow into the body. It has not crossed to the limits of the poisoning effect, and that adrenaline will affect ultimately the ovaries of the rats. And when the medicine has been given, the adrenaline dosage before completing the adrenaline dose, it has been reverted. That's it found that the stress-related infertility will come down with homeopathy. And the mechanism of homeopathic medicine action through miasmatic correction. What is this? We discussed about four things. One is psycho.
Excuse me,
Yes,
sir.
yeah. Immunomodulator
Sir,
effects.
we have only 2 minutes left.
Yes, madam. Yeah, I understood. So, psychology, emotional stress directly impacts fertility, cortisol, prolactin, and psychoneurological immunity. What is miasmatic correction? Psoriatic infertility is functional hormone imbalance. We also worked on the rats about because the miasmatic approach can't be forgotten for homeopathic doctors. So we dissolve the cases. Cytogenicity, PCOS, cyst, and hyperplasia. Syphilitic infertility, structural degeneration. Anti-miasma treatment to address the root predisposition, reducing recurrence of improvement of long reproductive health. We have left another 2 minutes. The clinical presentation first is Palestilla, Sepia, Tuja, Calcareacar, Natrimur. This all you might have tried. That which I have not given is Simisfuga and Murex. We have did our experiment with Simisfuga and Murex. I have a picture of pathways of the Murex and Simisfuga. That picture we have to make it 3D that has been delayed. That's why I never brought into the slides. I think it will come tomorrow. I will show you if I take the male infertility. Before that, I will show you the murex and simisfiga picture pathways that how they will control and the success rate of parrots which have been taken 19 out of that 9 have produced in responses. 2 parrots have died non-invasive. So by that if we have to reproduce that only in clinical trials. Our own data that which have been successful previously, we have seen they are successful only through these pathways. That's why we don't want to repeat that again clinically proving because the success rate already present with the existing homeopathic doctors. Non-invasive, safe, cost-effective, individualized treatment can be used alongside with the conventional medicine that is known as this has been developed to develop integrative homeopathic practice. Otherwise, there is a chance that homeopathy may die in future. That's why we are producing everything you can use with conventional medicine. Focuses on long-term reproductive health and integrative infertility model. Homeopathy plus lifestyle modification plus nutrition support plus modern diagnosis. And primary infertility is multifactorial. Homeopathy addresses root level imbalances, adds to neuroendocrine
Hello,
immunity
sir.
valuable.
Excuse me,
Thank you
sir.
very much. And take
Okay, okay, sir.
restoration of fertility is not just an induction of ovulation, but restoration of psychological harmony. Thank you. Thank you. There is no question for
Thank you, sir, and congratulations for the informative and intellectual session. Now we are handing over the session to the Malayalam team.